a significant percentage, I think up to 70% of mental health disorders are diagnosed by the before the age of 25, and about half of that are diagnosed in youths, in adolescents.
And in Belize, adolescents are experiencing a range of mental health illnesses, including depression and anxiety.
The adolescent age is a time of a lot of changes that happens, and then sometimes it's difficult. There's a lot of relationship issues between adolescents and their parents, and it all centered around the changes that adolescents are going through. And so we are seeing children attempting suicide. We know that some died by suicide. We know there's depression among children. What our statistics are showing why children are accessing mental health service more than any other disorder is for anxiety. And such, but this is an age of anxiousness for this age group. And so we are concerned about the health of adolescents.
And so the adolescence years are important for mental health promotion, prevention, early identification, and intervention. And that is why the Ministry of Health has embarked on a school mental health literacy program, which will be introduced in high schools to target 12 to 17-year-olds. It will be implemented through 6 lessons via the curriculum of life skills courses at schools.
The aim of this project is to equip teachers with the knowledge, sufficient mental health knowledge, to identify students that have mental health problems, to help decrease stigma around mental illness, to refer students to the appropriate and effective help, and also to help themselves with their own mental health.
Today, a group of core trainers from the Ministries of Health and Education, including teachers and counselors, are being trained in how to deliver the school mental health literacy program. They will in turn train other educators and professionals in the school system. According to Professor Stan Kutcher, the facilitator of the program, they've seen marked results in other countries.
We find that knowledge about mental health and mental illness improves substantively and sustained over time, very important, but also for both students and for teachers and for the families of teachers. We find that stigma decreases, so that with the decrease in stigma, people are more willing to seek help when they need it and not to be unhappy and not to be negative to other people who have an illness, so that peer-to-peer support, so that the communities change how they view mental illness, and it's become more supportive instead of ostracizing. And help-seeking efficacy, knowing when and how to seek help, improves as well, so that people seek help when they need it and not when they don't need it, but they also know where to go when they seek the help that they need.
The core trainers are also required to complement their face-to-face trainings with online courses. Reporting for News 5, I'm Andrea Polanco.